Staying on the health theme, the Department of Health says severe cases of cholera are on the decline, with the Health Minister, Dr. Joe Phaahla, providing an update on his department's efforts to curb the spread of the disease. Mpumalanga is the latest to report a cholera-related death. We speak now to the convener of the Progressive Health Forum, Dr. Aslam Dasoo, on the measures that have been put in place. Thank you very much, Doc, for your time this afternoon. Perhaps let's start with the appointment of a new health ombudsman. Your reaction?
Good afternoon. Thank you for inviting me. The one thing one can say is that one can be grateful for the swiftness of the replacement of the outgoing ombudsman, Professor Mokgoba, who did a remarkable job in that position. Many of us are very well acquainted with Professor Mokoena, the newly appointed ombud, who one must be assured is a highly accomplished professional, and is professionally highly qualified for this post. There is a broader consideration, given that this post is an oversight body and requires a degree of independence, to the extent that Professor Mokoena has been associated with the governing party for a very long time, and has had a high profile in some rather controversial matters, I think detracts from the appointment somewhat. But, this is less a problem about Professor Mokoena than the process by which regulators are appointed. They should be scrupulously independent of the prevailing political establishment in order to conduct their work. And certainly Professor Mokgoba demonstrated his almost fearless independence from the state. And so one hopes that somehow Professor Mokoena is able to avoid being compromised by that history, and I can already see a number of people raising severe objections in this regard.
I would like for us to expand on what you say is the independence of prevailing political establishments when we speak of an appointment of this kind, because the NHI bill has been approved by the Portfolio Committee on Health in Parliament, and now it's waiting to go to the National Assembly for debate. The previous health ombudsman held no bars held, where he would outright talk about the dismal state of health in the country. I was having a conversation with somebody this morning that mentioned that a family member of theirs was at a public hospital. They did not even have a blanket in this week, one of the coldest days of the week. They did not have a blanket. And so when we speak about things like the NHI, when we speak about the independence of prevailing political establishments, why is that important in the broader scheme of things?
Well, I think it's the lack of it that demonstrates its importance. We've seen in various failures of governance in this country, the primary and the proximate cause of it has been the compromising of oversight institutions, all the way from Parliament to Chapter 9 institutions and others. And it's always the same story. It's always political interference that results in a breakdown of the functions, in a attenuation of the correct outcomes, and so on. So, the idea that institutions of democracy need to be scrupulously independent is not new. In fact, it's fundamental to democracy. And it is exactly the blurring of that line that threatens our democracy, as we see practically on a daily basis. The health sector is particularly prone to this, and most of the regulatory bodies there, are all appointed by the political principle, and we see their dysfunction as a result of that quite clearly. Just a few who stick out that have managed to resist this, like for example SAPRA, are able to then do the work that they need to do fearlessly, independently, and work in which the public has confidence. That is not the case for several others. And I think a review of how these regulatory bodies are established in the interests of the country. It's always in the interests of the people, never in the interests of the prevailing political hegemon or whoever's running the government at the time. Indeed, the oversight is over them. And so the independence is absolutely crucial as a result.
Speaking of public confidence, we heard from the health minister again pointing to a downward trend in terms of cholera infections. We heard also yesterday that the Rooiwal wastewater treatment will cost some 4 billion rand to repair. And so what have you made of some of the measures that have been announced to contain the spread of cholera in the country?
Yes, well, look, I think it's important to state up front that it's taken a disaster to again move the government to do the obvious. The obvious being, of course, taking care of the ill and the critically ill, especially who have succumbed to cholera, and the health system is responding adequately to that, as we would expect, given that it's not such a huge outbreak at this point. It may grow there, but it seems all signs are pointing toward its subsidence thanks to the efforts of people themselves. Very little can be put to the credit of the government here. Indeed, what we have heard ever since this outbreak is a lot of noise, a lot of visits by politicians, all declaring great concern, but unable to provide, first of all, the means to end the problem, and second, any reference to how we ended up here. So if after 15 years of a plant breaking down, and had a plant in the capital city of the most industrialized country on the continent, a simple wastewater management plant, the local government can't even manage to make that function or to fix. This was an inevitable outcome. So there's a tragedy that must be always put in front of any measures that they laud as being successful. That tragedy means that over the past 10 to 15 years, all of those responsible, obligated, and having taken an oath to ensure that the functions that they are meant to provide are provided, have been derelict in their duty and must be held to account. If you don't, what's going to happen now? Suddenly 4 billion rand is found for something that could have been fixed for perhaps 1/10 of that at the time. But they ignored it. What did they think was going to happen? Now we have 4 billion rand suddenly we have to find, and it will take till 2027 to have the water reticulation of Hammanskraal fixed. Might I say, the very earnest-sounding mayor, who's coming quite recently, we're expecting to a baptism of fire here, is frantically looking for the source of the infection. Well, that's a wild goose chase. It's of no consequence now. The cause of the infection and the outbreak is the breakdown in water reticulation. It's very simple. We know what the cause is. And if he wants to find the exact source of this outbreak, all he has to do is look around his chamber, and they all sit there. The causes are all there, and their predecessors. So I think we must take what the government says with a pinch of salt. They must do what they need to do to protect the people now. But even taking 3 to 4 years from now to fix the water reticulation is both a function of their inability to act quickly, but secondly, they've let the situation deteriorate to this point where it's going to take a meaningful exercise and a huge amount of expenditure to fix. We can't function like this. And I really think that when people die, the consequences are such that we have to first determine how they died, who is to blame for that. Blame is important for the families to get a measure of justice in this. And I think that's a very important consideration. They don't talk about it. None of the politicians do, from any party, because they all know they are complicit in those deaths, but they are insulated from the consequences by virtue of being appointed by their parties. That's a matter of how the political establishment is structured.
Dr. Dasoo, I'd like for us to stay on the two words of public confidence. If we're not ready for the diseases of today, we can somewhat understand COVID-19. It caught everybody unawares. In fact, everybody was struggling with it all over the world. If as a country we're not able to deal with this today, are we ready to deal with the virus, with the disease of tomorrow on a health level, nationally?
Unlikely, given our level of preparation. But you're quite right about making this distinction. COVID caught the whole world off guard. And those systems, or those countries which had systems that were resilient, did better than those which didn't. We didn't do too well, I need to say. And how we got through this was because of our health workers going above and beyond the call of duty, losing 2,500 of their colleagues in the process, not thanks to any government intervention. They had to be even pushed to get us vaccines. So we have a real a poor legacy as far as that is concerned. But this cholera occurs naturally and will flare up when there's an earthquake or huge flooding, as we've seen, or when the simple function of water reticulation, piped potable water and proper wastewater management is absent or is broken. Well, that has occurred right here in Hammanskraal. We didn't have a flood. We didn't have an earthquake. We had a political breakdown. And when you have a breakdown of governance, people die. And unfortunately, we are not being ready for a novel pandemic. One can excuse a lot of things when you are not. In this instance, there's no excuse. They were warned repeatedly from when this thing happened that this might occur. They ignored that. Now, who are you dealing with here? If they can't manage something like that, why are they even put in office? It's really puzzling to all of us. And health workers will tell you straight up, they understand this illness. They understand, they see its consequences in ways the politicians don't see it and don't understand it. When you have the minister and the president insisting stridently that, look, this is just an outbreak in Hammanskraal and only in one area of Hammanskraal, so don't get overexcited. What you are seeing is clear political deflection. She doesn't even get it. And that's a real worry for the governance of South Africa.
Convener of the Progressive Health Forum, Dr. Aslam Dasoo, thank you very much for your time this afternoon.